Raywat, what changed here from the European Union and the data here that Manitoba and other governments are issuing this warning and essentially putting the pause on this vaccine for those under the age of 55?
There were a couple of studies out of Germany and Norway looking at a potential biological linkage between the vaccine and these very rare events. So there's something called heparin-induced thrombocytopenia. That's when the drug heparin, which is an anticoagulant, can sometimes bind to platelets and your immune system has a reaction to it. And a minute handful of cases that are observed in Europe following the vaccination resemble that. And they have coined the term vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. And so now that there is a mechanism that kind of describes the process, then it makes sense to suggest this might be a causal relationship. Even though they are vanishingly rare, the responsible thing to do is to issue guidance to reduce that rarity even more so.
So why not do this when several other European countries decided to pause? We continued on and kept saying, listen, it's not the same batches, it's not the same doses, everything appears to be okay when other countries did put the pause on.
Yeah, I mean, maybe a pause was the right thing to do as we investigated, but at the same time, the European countries continued afterwards, after their pause, even after reaching the same conclusions. So there's just a timing issue of when the committees meet and assess the evidence. I'm not defending the process or explaining the process. That's my understanding of it, just a timing issue. Frankly, I'm not sure what the right thing to do here is. I think NACI's recommendation is the right recommendation because it follows what is known and reduces risk even further. Keep in mind, they're not saying don't use the vaccine. They're saying limit the population it is targeted to reduce a small risk even further. That's the takeaway message here. And it's based on a calculus of risk. So for those under 55, your risk of anything bad happening as a result of COVID is smaller than if you're over 55. Therefore, the risk of anything bad happening with the vaccine is less tolerable. It's a relative measurement. So that's the way the math works out. It's comparing risk levels.
Health Canada demanding that AstraZeneca do a detailed study on the risks and benefits across multiple age groups. The agency has also said it has not received any reports of blood clots in Canada to date. Would the data, Raywat, exist right now, or do they still have to issue the vaccine to get the data?
Every country has an adverse reaction reporting system, and every country has a different process for it, and some have better ones than others. So the Scandinavian countries have better adverse reporting requirements than we do. So the company has to request that data and go through them in detail, and also maybe request patient files and even more intensive investigations of patient medical records that often aren't reflected in the adverse reporting databases. So it is an involved process. Keep in mind, this vaccine is the world's vaccine. It's the one used by COVAX. It was developed to be deployable across the entire world. It's used at scale in India and other poor countries. And we've not seen similar signals at a global level. So if this is a causal relationship, it is vanishingly rare. So let's not get overly energized by the prospect.
When we look at this situation that's been unfolding, I guess what is your takeaway to people that have perhaps had the vaccine and are now perhaps a little extra concerned?
Right. So remember, what little we know about the risk is that it's based on these Norwegian studies. So 78% of the doses in Norway went to women, and that's where we saw most of the bad things happen. I think 19 out of 21 cases were amongst women of reproductive age. So it seems to be focusing on a certain demographic. If you're not of that demographic, your risk is exceptionally low. If you are of that demographic, your risk is still exceptionally low. In fact, your risk of getting a clot from being on the contraceptive pill is thousands of times higher, and yet we don't hear that being newsworthy as much. So if you've already had the vaccine and you are of that age group that is at high risk, don't be concerned because it's still an exceptionally small risk. It's 1 in a million or so. But now we know what to look for. So look for those symptoms, and if you have those symptoms, there is a treatment. Just report to your doctor and you'll be fine.
With Raywat Deonandan on 680 CJOB from the University of Ottawa, let's talk about the variants. What are we seeing across the country, and certainly what are we seeing in Ontario?
Well, the variants are upon us, and they are the mechanism for the third wave. Globally, the reproduction number R is about 1.2, if not higher. In Ontario, it's 1.15 last I checked, which is exceedingly high. That's well into high exponential growth. So we're about to see some very high cases very soon. And the variants are more serious, not just transmissible, but they're more likely to put you in the hospital and more likely to kill you. So right now in Ontario, the ICU beds are hitting capacity. Dr. Michael Werner had a really interesting tweet the other day, which just resonates with me. He says, the third wave is a race between vaccination and variants, but the variants have won already. And now it's a race between vaccination and ICU capacity. So can we keep transmission low enough to prevent the overwhelming of our system? That's the unknown.
And I think what may be interesting to some people watching some of the coverage on the weekend out of Ontario is that they're physically moving some patients, and I'm not talking within a city, very long distances as a result of capacity issues.
That's right, Toronto to Kingston, that kind of thing. So it's a serious concern. This time last year, we had canceled all elective surgeries. We had braced ourselves for an assault on the healthcare system. And so we didn't feel it as much. And people have to realize it's because we had a fully staffed healthcare worker population and we have empty hospitals. Now the hospitals are full. Our healthcare workers are overtasked and exhausted, and many of them are at home with COVID. So the ability for us to absorb cases is much diminished right now. This third wave is going to be hard. I don't think that's fully understood yet by the population.
He is University of Ottawa epidemiologist, and we rely on him for all sorts of COVID-related and vaccine-related topics. Raywat Deonandan joining us live here on 680 CJOB. In about 11 minutes, Christian